What is Medicare? Who is eligible for it and how does it work? Medicare is health insurance provided by the U.S. government for people over 65 or for some disabled persons. Medicare is made up of 4 parts: Part A, Part B, Part C, and you guessed it, Part D. Plus, there is another option called Medicare Supplement that we will discuss later. Let's talk about what the letters really mean. Parts A and B are what is known as Original Medicare, which most people are eligible for when they turn 65. Part A is automatic. Parts B, C, and D, on the other hand, are optional. Part A is hospital insurance that helps pay for things like inpatient hospital stays, skilled nursing care, hospice, and limited home health care. If you or your spouse has worked a minimum of 10 years and paid in at least 40 quarters of Medicare taxes, you are automatically enrolled in Part A with no monthly premium. Part B is medical insurance that helps pay for doctor's visits, outpatient procedures, diagnostic tests, medical supplies, and vaccines. Preventive benefits like certain screenings such as mammograms, diabetes, and prostate screenings are also included. Most people have to sign up for Part B, and it typically comes with a standard monthly premium that is determined by your income. To make things easier, your Part B premium can be deducted from your monthly Social Security check. Medicare Supplement plans, also known as Medigap plans, act as secondary insurance to Medicare. Medigap plans are designed to help cover some of the costs not covered by Original Medicare Parts A and B, such as deductibles, copays, and coinsurance. With Medigap plans, you can also choose any doctor or healthcare provider that accepts Medicare. Medigap plans don't cover things like vision, hearing, dental, or long-term care, and they don't cover prescription drugs. Keep in mind, with a Medigap plan, you pay both Medicare Part B monthly premium and your Medigap plan premium. Original Medicare Parts A and B and Medicare Supplement don't cover prescription drugs. That's where Medicare Part D comes in. Medicare Part D is offered by insurance companies like Highmark, and it helps pay for prescription drugs. Each prescription drug plan has a list of generic and brand name drugs that are covered by that plan, called a formulary. Each drug is assigned to a tier, which determines how much you will pay for that drug. Highmark has a transition process to accommodate the needs of new enrollees whose current regimens include drugs that are not on the plan's formulary, or those drugs that require prior authorization. You can get Part D either as a standalone plan or as part of a Medicare Advantage plan. It's up to you and your needs. Here's how Medicare Part D works. You can sign up for Part D when you first become eligible for Medicare. Part D is optional, but if you do not enroll in a Part D plan when you first become eligible, there may be a late enrollment penalty. The late enrollment penalty is calculated by multiplying 1% of the national base beneficiary premium times the number of months you went without other credible prescription drug coverage. By enrolling in Medicare Part D when you become eligible, you can save money on prescription drugs, better manage your healthcare budget, and have prescription drug coverage in place should your health needs change in the future. Prescription drug coverage can be broken into 4 stages: deductible, initial coverage, coverage gap, and catastrophic coverage. The deductible is the amount you must pay each year for your prescriptions before your Medicare prescription drug plan begins to pay its share of your covered drugs. Most of Highmark's Medicare Advantage plans have a $0 deductible, so coverage begins with the first dollar you're charged for prescriptions. Once you enter the initial coverage, you pay a copayment or coinsurance for your covered prescriptions, and Highmark pays its share for covered drugs until the combined amount reaches the yearly amount, which is $3,310 in 2016. Here's an example. Let's say a 30-day supply of a preferred generic prescription drug costs $100. With Highmark's Part D plans, you would pay a copay, for example $5, and Highmark would pay the remainder of the cost, in this example $95. However, the total drug cost of $100 is the amount that would count towards the initial coverage limit of $3,310 in 2016. Most Medicare drug plans have a coverage gap, also called the Doughnut Hole. The coverage gap begins after you and your drug plan together have spent a certain amount for covered drugs. In 2016, once you enter the coverage gap, you pay 45% of the plan's cost for covered brand name drugs, and 58% of the plan's cost for covered generic drugs until you reach the end of the coverage gap. Not everyone will enter the coverage gap because their drug costs won't be high enough. Once you get out of the coverage gap, you automatically move into the catastrophic coverage period. With catastrophic coverage, you only pay a small coinsurance amount or copayment for covered drugs for the rest of the year. Are you looking for an all-in-one plan that includes medical and drug coverage? A Medicare Advantage plan from Highmark may be right for you. Part C plans, also called Medicare Advantage, are offered by private insurance companies like Highmark and act as primary insurance instead of original Medicare. Medicare Advantage plans help with hospital costs, doctor's visits, and other medical services that are covered by original Medicare. Plus, Part C plans offer worldwide emergency and urgent care and can include coverage for prescription drugs, routine vision, hearing, dental, and even gym memberships. All of this comes in one plan with just one member ID card. So how does Medicare Advantage work? For starters, you have to be eligible and enrolled in Original Medicare Parts A and B. You also need to pay your Medicare Part B premium along with your Medicare Advantage plan premium on a monthly basis. When you have a Medicare Advantage plan, you pay a copay or coinsurance for only the services you use and not for those you don't. Highmark's Preferred Provider Organization plans, also known as PPOs, offer more choices in doctors by letting you choose services out of the network. But you may have to pay more for those out-of-network services. To help keep your costs down, you will need to pick a doctor in Highmark's network if you choose a Health Maintenance Organization plan, also known as HMO. Whew. That may be the fastest explanation of the Medicare alphabet ever attempted, but hopefully that gives you a basic understanding of Medicare and how it works, and you're on the road to choosing the right plan for your healthcare needs.